When our son was diagnosed with stage 4 cancer, we wanted to know everything science and experience has proven effective. What we found was a lot more than we were shown at the hospital. With so many highly educated, seasoned professionals operating outside the bounds of conventional medicine, it just didn't make sense to limit ourselves when the stakes were that high. This approach paid off, and now we're bringing the information to you. Wisdom from the top integrative and holistic cancer doctors and healers around the world, all in one place. Because you deserve true answers to cancer. It's time for a revolution against one-size-fits-all medicine, a revolution that takes us back around to the old ways of healing and forward to the new. That revolution starts right here. When it comes to reversing or preventing cancer, this is where you come for the best of the best. I'm Ryan Sternagel of the Stern Method, and this is the Anti-Cancer Revolution. Hey there, it's Ryan, and this is one of my favorite talks from our Anti-Cancer Revolution online conference series. Stick around to the end to find out how to ask these healers anything you want yourself. But in the meantime, enjoy and take something you can use right now from the show. Welcome back to the Anti-Cancer Revolution, everyone. This session we have with us Dr. Sharon Stills, NMD, or naturopathic medical doctor who provides therapeutic and diagnostic services to patients in need of a different approach. She believes that the mind and body must be treated as one in order for every person to enjoy genuine health, true happiness, and to experience their deepest passions each and every day while they are enjoying the gift of being alive. She has successfully helped thousands of patients and is known for her successful treatment of all types and stages of cancer, either entirely with alternative methods or via integrative treatments. Dr. Sharon Stills is a graduate of the Southwest College of Naturopathic Medicine in Tempe, Arizona. This college is one of the nation's foremost accredited medical schools. She is a leadership member of the American Association of Naturopathic Physicians, the Arizona Naturopathic Medical Association, and the Oncology Association of Naturopathic Physicians. She specializes in European biological medicine, having trained extensively with Dr. Thomas Rau of the Paracelsus Clinic in Switzerland, and is one of the lead lecturers for the Swiss Biomedicine Academy in North America. Dr. Stills travels the world seeking out and bringing back to the USA the best of natural medicine options. Dr. Stills is a seasoned meditation teacher of mindfulness-based stress reduction, as well as one of the few leaders in the USA of AUM meditation process, which she studied in Holland. Having overcome serious health issues of her own, Dr. Stills practices what she preaches. She loves to cook and eat a healthy paleo diet. She swallows more vitamins daily than she will ever ask you to swallow, prioritizes a good night's sleep, and is grateful for all that she has. When she's not working with her patients or on her new book, she can be found peacefully meditating or yelling excitedly while watching the New York Jets game. That's quite the impressive and entertaining bio all at the same time. How are you today?
I'm doing great, Ryan. Thanks for having me. I'm excited to be here.
Yeah, it's good to have you on, and I'm really excited to have you on because you are going to talk about some really interesting things that actually kind of, we were just talking before we started recording, answer some questions that are unanswered questions for me that doesn't always happen these days. So I'm really excited to get you on, and hit sneak preview for everyone checking, watching. We're going to be talking about some really advanced testing stuff and how to measure your lymphatic system, which I didn't even know was a possibility. So I'm really excited. But that being said, to start, I always like to ask just, why is it that you do what you do? What got you into being obsessed with cancer, of all things, like all of us are that are doing this summit?
Well, to be honest with you, when I was in medical school many years ago, I never saw a cancer patient. So I was really focused on pediatrics and psychiatric care. And that was like kind of what I was known for. And that was my thing. And I just never treated cancer. So fast forward 4 years, I graduate, I go open my own clinic, and the 7th patient in my door is an elderly gentleman, probably like late 60s. I think he was like 68 at the time. He comes in and he says, "I'm desperate. I have pancreatic cancer. My doctor told me that there's nothing I can do to go home and get my affairs in order." He's like, "I was driving by and I saw your sign that you're like a natural doctor. Can you please help me?" And I was like, you know, brand new doctor, like this, like, it's like my first week of opening my own clinic. And I was just like, oh my gosh, I felt this like major responsibility. Like, here's this lovely man and his lovely wife, and they're coming to me and they're desperate. And I just took a deep breath and I remembered like all the principles of naturopathic medicine and how the body works, and how it's not so much always about the diagnosis. It's about the physiology. It's about what's going on emotionally. And I just said to him, I said, honestly, I've never treated cancer patient, but I will do what I can. I see you're desperate, and I just want you to know, so I'm not giving you like any false hope or anything. I just want to be perfectly transparent with you. And I remember his first visit, we were talking about diet, and like he couldn't understand why I didn't want him to eat margarine. And it was like a 45-minute conversation on how, you know, margarine's no good and processed foods are no good. And I was thinking to myself, oh my goodness, like this is a real uphill battle. 45 minutes just trying to explain to him. And I thought, oh gosh. So long story short, he just realized he didn't need to eat margarine. He realized he needed to do whatever I said to do. And he just like got on board, and I treated him just knowing what I knew about how the body works and detoxing him and doing all these different things. I used part of the Kelly protocol, which uses high dose pancreatic enzymes, and he ended up being cured. And it was quite an experience for me as a brand new physician out in the field. And it taught me a lot about always having hope, not being scared of something I've never seen before. And he died about 10 years later, but it was not because of his cancer. It was unrelated. It had to do with his cardiac valves and a heart issue. But what happened was he was a member of this very large church where I was practicing, and he brought me there so they could pray for me and thank me. And so all of a sudden, I became the cancer physician, because all of the people at the church started to come see me because they saw the results I had with him. And I had a similar experience happen with another patient who had stomach cancer and was told there was nothing he could do. And I treated him, and he also was cured, and he was a member of an Orthodox Jewish community. And so they took me to the synagogue. Everyone from that synagogue then started coming. So I had the synagogue patients, the church patients. We had a very colorful waiting room and office. It was a lot of fun, but that's basically how I became an expert in treating cancer. It just kind of found me. And I really believe what walks in my door as a physician is what I'm meant to be working with. So that's how I became cancer obsessed. And of course, being privileged to be on these patients' journeys and see them living full lives when they were told they weren't going to be here. That's a sacred, really gratifying experience that I'm very humbled to be a part of every day.
That's an amazing story. I'm really glad I asked. That's certainly a Lord works in mysterious ways type of thing.
Yes.
Certainly never planned on being here talking to you 5 years ago before my son was diagnosed, but here we are. And one of your major topics of focus that you wanted to talk about today was European biological medicine, diagnostics specifically within European biological medicine. Before we dive into the diagnostics part, we have medical doctors on this event. We have naturopathic doctors. Your title is a naturopathic doctor, but they practice naturopathic medicine. We have functional medicine practitioners. There was Dr. Scott Schur had kind of coined his own brand of medicine. When you describe European biological medicine, how is that, what differences, if any, are there from, what folks over on this side of the pond, at least, are more used to hearing about, be it, naturopathic medicine or functional medicine, that sort of thing?
I think one of the big differences with European biological medicine is that we're really looking at regulation. So yes, I do a lot of naturopathic therapeutics. That's my training, that's my title. I do a lot of functional medicine, diagnostics, and treatments as well. But in European biological medicine, we're looking at how the body regulates. We're looking at the nervous system and how organs regulate, and we're looking at the terrain. So we are looking at this extracellular matrix. And I think that's something that functional medicine and even naturopathic medicine forgets about. We're really focused on cellular physiology. We're very focused now on epigenetics, which is really important. But these cells are bathed in an extracellular matrix. They're bathed in this fluid, in the connective tissue. You can call it the mesenchyme, you can call it the internal milieu, the terrain. And this is how toxins are getting out of the body, how nutrients are being delivered, how the cells are communicating with each other. And if we don't have a healthy extracellular matrix, we're not going to have healthy cell function. So it's really important that that is focused on, that we start to look at how we are eliminating and draining organs, and not just so focused on what do I need to take, what do I need to, what vitamin or what supplement do I need to take, but what's actually the health of the cells and the surrounding area in the cell. And so there are so many things that contribute to this extracellular matrix. It has to do with lymphatic flow, has to do with the pH of the body, has to do with hormonal balance, mineral balance, enzyme balance, viruses, fungus, parasites. All of these things play a role in how we're regulating. Also our thoughts, our emotional state, our stress levels. And so I really like to look at a patient and start to balance and clean out the extracellular matrix. We see that, like where tumors develop, the extracellular matrix is all clogged up, it's all gunked. And so you can't get good nutrients in, you can't get toxins out. So we have to clean outside. If you think of like a popular analogy many of you have probably heard of, is like the fishbowl. So if you have a fish tank and you have the fish in the water and then the fish dies, what do you really need to do? You don't, if you just take out the fish and put the fish, another fish back in, if the water is polluted, that fish is going to die too. So you have to go in and clean out the fish bowl, put fresh water in, and that's the extracellular matrix.
The tumor ended up there as a result of the matrix being gunked up, or the matrix is gunked up because the tumor is there?
I believe it's because the extracellular matrix is gunked up. It's the matrix that kind of controls whether we have health or not in the body. So that's why we have to make sure it's functioning healthy and doing all these things. And then we can figure out what we need to do for the cells. But if we don't have the cells bathed in a healthy environment, then we're kind of fighting a losing battle. So if you think about like germ theory, so like Louis Pasteur, who created germ theory. So you're hanging out and then, someone has strep throat and then you catch it. So that's the theory that pretty much allopathic and our regular mainstream medicine here is based upon, that you catch something. Don't come near me because you have strep throat and I don't want to get it. But if that was really true, as a physician in the trenches seeing patients all day long who have pneumonia and strep throat, why don't I get it? So I believe that we catch germs if our internal milieu or extracellular matrix is imbalanced. And so that sets us up to be predisposed to have an issue occur. So like back in the day, there was, what was his name? Antoine Béchamp, who was a contemporary of Louis Pasteur. And he said, he was kind of saying, no, Louis Pasteur is wrong. It's not the germs it's that we're setting up an environment in our body if we're stressed, if we're toxic, if our lymph isn't flowing, if our pH is off. And that's allowing these germs to take place and get hold of us and cause disease. And it said that, I wasn't there, but it said that Pasteur on his deathbed said, he was right. I was wrong. The milieu is everything. It's not really the germ theory.
Yeah. Do you want to get into the diagnostic side of how you're actually determining the what's going on with this internal milieu? Because this is something I wasn't entirely aware of to the degree that you're taking it. So yeah, please expound.
So one of my favorite tools that I use for diagnostic is the CRT, which is computerized regulation thermography. And so if you stop and go back to like the time of Hippocrates, like 480 BC, he was actually um, he was actually using thermography with mud. So he would take mud and put it over patients, and wherever the mud would dry first, where the hottest area was, that's where he would diagnose the diseased organ. And so this was a very, preliminary way of doing it, but it actually, worked for the father of medicine. And so then in about, I think it was about 1956 here in the States, they started using infrared imaging, and they would see that the skin temperature over areas in the body that had cancer had higher temps in the venous blood that was draining away from the tumor. And it was warmer than like the arterial supply. And so this was like where it started developing here. And then at the same time in the 50s, there was a Professor Rost over in Germany who developed the tool that I used, which is the CRT. And so what computerized regulation thermography is, so some of you may be familiar with thermography, especially for breast health, for you ladies out there. And that's where like you go and you have an infrared image taken and you can see the different colors. So you can see where it's red and where there's more blood supply, and that's where we think tumor development is happening. The machine that I use is a lot more profound and deeper than that, because it's looking at regulation of all the organs of the body. And so what we are doing is actually using a handheld infrared thermometer that's taking temperature readings all over the body. There's about 120 points that I do over the body. And then when you're done taking, and the reason why we take these points is because there are these neurocutaneous reflex points. So you can measure a point here and that's related to a sinus, and you can measure a point here and it will be related to the lungs, and there's points that are related to the liver and the pancreas and the ovaries, all the major organs. And so we can get an idea of what's going on with no radiation, with non-invasive techniques. And so measure all these points, and then the patient has to stand in their underwear. The room is temperature controlled between 68 and 72 degrees. The patient stands, so the first point readings, they're kind of wearing clothes and we're kind of undressing them as they go. When the point readings are done, and it only takes about 10 minutes, they then stand for another 10 minutes in just their underwear. And that's considered a stress to the autonomic nervous system. It's a cool stress. And so the body should respond in a certain way. Most points should cool as blood is like rerouted to the core, as you would have in like a typical fight or flight response. So after those 10 minutes are up, where they just stand there, then come back in and we retake all the points all over the body. So now we're seeing how the body regulated. And so there are over 50 disease signature patterns that have been shown time and time again since the 50s that have been documented. They've been correlated with x-rays, with pathology, with blood tests. So I call my CRT as like my naturopathic treasure map. I like to get a scan on a patient because I can see what's going on. So you can do a blood test or you can do a functional medicine test, but that's like further down the road. I want to see regulation so I can see before things show up in the blood or before they're going to show up on a CT scan. I can see, oh, look, this organ didn't regulate properly. It's blocked, or it's regulating the wrong way, which we call a paradoxical reaction, or it's hyper-regulating. And so I can tell so much about the body, the matrix, the milieu of the body, what's going on just by taking these points. And as far as cancer goes, for women, it's a specific screen for breast cancer. And for men, we do a specific screen for prostate cancer. And I love the screen for breast cancer because it really goes to show how breast cancer is not just this individual issue that the whole body is involved. So for example, we have about 12 different criteria that are related to breast health. So when you go and just get the picture done, you're just looking at the breast and you're saying, oh, look, you have heat there, you know, which is helpful information. But when we're doing the CRT scan, we're getting so much more information. So we're measuring the lymphatic system. And this is the only diagnostic test I know that actually measures the lymphatic system, and it's objective. This test is reproducible time and time again. So you can measure, you could kind of look at symptoms and say, oh, you have cellulite, your fingers are puffy, you know, you can kind of say, oh, you probably have a lymph issue, but I'm measuring specific points in the tonsils, in the cervicals, in the groin area, in the axillary area, so I can actually see which areas of the lymph are not functioning, are inflamed, are blocked. And so lymphatic congestion is a huge, huge, huge factor in breast cancer, either development or if you have breast cancer. And so not only do we look at the lymphatic system, but we're looking at the health of the liver, we're looking at the health of the chest and the sternum and how regulation is. We've seen that the opposite ovary, so if there's an issue on the left breast, the right ovary will often have an issue that's contributing to the breast cancer. And we're also looking at the teeth. And so there is a major connection between the teeth and cancer development as well. So being able to look at regulation of the body just gives me so much information. I can see if there's a heavy metal load, can see if there's imbalances in the microbiome, can see if the pancreas is not regulating, the kidneys are not regulating, all the eliminatory organs. So it gives a great deal of information.
That's amazing. You find on your scan the lymphatic system to be congested in a particular area. What do you do to go about, you know, correcting that with the patient?
That's a great question. And I can tell you that pretty much always I see a lymphatic congestion. So it is a chronic issue. So for all of you listening, I think this is a really important topic to really be looking at what's going on with your lymph system. So it depends. So like our lymph system, you know, we have the thymus gland, we have the tonsils, the bone marrow, the spleen, our appendix, we have the Peyer's patches in the intestine, which I'm obsessed with. So we have all these different organs. So for example, for the tonsils, so a lot of people have blockages in their tonsils. So what I'm looking at is regulation blockages. So you can have scars on your body that can be creating a regulation blockage in your health that can be contributing to cancer development. So if your tonsils are blocked on the thermography scan, then often I need to go in and do injections like neural therapy injections where we can inject in homeopathic remedies and procaine and open up the area and let it drain. A lot of patients that I see have chronic tonsil infections, and you can look in the mouth and you might be able to see some people have like kissing tonsils. They're so huge they're actually touching each other, and we call them kissing tonsils. You can see crypts. Sometimes you can see pus and mucus that are like embedded in the tonsils. And so it's really important that we start opening up these areas. And like, so especially for children, it's very common if they have swollen tonsils, what do? We remove their tonsils. But we have to remember that the body is not just these individual components. It all works together. It's all reacting to each other. And so if the tonsils are swollen, often it's because the Peyer's patches, which are in our intestines, which is where the majority of our immune system lies, they're overworked. And so they're recruiting the tonsils. They need more help with lymphatics. So the tonsils are swelling to try and take over some of the load. And so when I see different issues in the lymphatic system, I'm utilizing lymphatic drainage remedies, I'm utilizing castor oil packs, I'm using dry skin brushing. I'm a big fan of sweating to get the lymph moving. And I think you really need to do like hands-on things. So it's great to take specific herbs, and a lot of people know about like rebounding, jumping up and down. But my experience is that just taking some herbs and doing some rebounding and skin brushing are not enough for me to really start to see changes when I rescan a patient. So you've got to really get in there, be sweating, doing castor oil packs to the areas where you have the congestion, using either like getting lymphatic massage and drainage, getting neural therapy injections, and using like a light beam generator or a lymph star machine, something that's going to energetically start to drain and get the lymph moving. So it takes some time and some work, but when patients, get on board and start to do all these things to take care of the lymphatic system, I can recheck them in a couple of months and I see the lymphatic system is draining, and then I see the breast health is improving.
Did you say a lymph star machine?
Yes. So these are machines that use like focused energy and different wavelengths to drain the lymph. And so they're like, they're handheld machines that are used. We had a machine in my office that patients hold. We use the light beam generator, and they hold like these two wands, and they just put it to the different areas where where I've seen the lymph is congested, and it just gets things moving. We have to remember that the lymph is not like our blood system, our circulatory system, that like right now you and I are sitting here talking and blood is pumping and things are happening without us even consciously thinking about it. But the lymph system only moves through exercise. It doesn't move on its own. We have to make sure we are manually getting our lymph to move. And so if you lead a very sedentary life, you're sitting at a desk all day like many of us do, or staring at the computer, it's important to get up, walk, move your lymph, and make sure you're taking care of it, making sure you're properly hydrated. Because if we have like lymph that's not moving, it will get like very thick and dirty, and that too will encourage like degeneration in the cells, and that's going to also lead to tumor growth. So the lymph, I feel like the lymph is very overlooked, and I'm very obsessed with the lymph because I just see with my work with cancer patients, if I don't focus and really pay attention to their lymph, we're not going to have as good an outcome. And there's no there's no specialist in lymph. It's like this forgotten system that is so important. We have, I think it's like 3.5 to 5 liters of blood that circulate throughout the day, and we have 6 to 10 liters of lymphatic fluid. So that's a lot more. And then, so of that, like 1.5 to 2 liters of the lymph is going to circulate daily. But if you pay attention to it, you can get that up to like 10 to 30 liters. And you have to remember, this lymph is going to go in, it's going to collect the debris, it's going to collect damaged cells and viruses and cancer cells, and it's going to get it moved out of your body. And so it's also going to help bring in good stuff and nutrients. And so it's super, super important. I mean, it runs right along all our blood vessels, but we seem to like not pay a lot of attention to it. I'm not sure why, when it's such a crucial, crucial piece to healing.
I don't think it happens all the time, but I know with a lot of like conventional medical doctors, they can be under the impression that, and tell their patients that, stimulating the lymph system would actually be a bad thing, because then you'd be spreading cancer cells around and that sort of thing. Could you address that?
Yeah, I totally disagree with that, because we need to clean things out. If you don't, it's not going to spread, it's going to clean and cleanse and detoxify. So I would not be worried about getting your lymph moving. I would be worried about not getting your lymph moving, because it's going to then encourage more cancer. So it's just a very different way of thinking about it. So I'm all about the lymph, all about the lymph.
Sure. And then could you expound on the teeth connection portion of what you were mentioning as well? I think that bears a little further exploration.
Sure. And before I do that, I just want to give a good analogy. Like when you think about the CRT, think about like when you go to the cardiologist, like a test that they do is like a treadmill test. So yes, they listen to your heart, but then they want to do a stress test because they want to see dynamic activity. And so the computerized regulation thermography is like analogy to that. It's looking at your body in action. And that's how our bodies function. Health and disease occurs as we're moving through the day and reacting and responding to all the different things we're exposed to. And so it's just a good way to think of it. So in the thermography, we also look at the teeth. And so it's another reason why I love this, because my training in Europe, which started very early while I was still a student, it was drilled into my head that disease and cancer comes from our mouth, like the majority of the time. And so for me as a physician to heal a patient, I have to be working hand in hand with the biological dentist. And often we have to be cleaning up the teeth before we're even addressing the body. And so in the thermography scan, we measure each and every tooth and can see regulation. So if the tooth is blocked, that's an indication that there's something going on there. It could be a root canal, it could be mercury fillings, it can be from galvanicity, from different electrical currents that are going on in the mouth, from different metals that are placed there. It could be periodontal disease, and each tooth, we have to remember, lays upon a Chinese acupuncture meridian. So we'll take breast cancer, for example. The top molars are the breast teeth. They lay on the stomach meridian. Now, the stomach meridian goes right through the breast. So breast health is associated with the stomach meridian. The thyroid also sits on the stomach meridian, and I see a lot of thyroid issues in conjunction with breast cancer as well. So we saw over in Europe at the clinic, 98 out of 100 women who had breast cancer had a root canal on that tooth. And so that's a very large percentage. And so root canals, which are creating toxicities, low-grade toxicities that are draining our immune system constantly, in my opinion, are very correlated with cancer. So I need to see what's going on in someone's mouth so I can get their mouth cleaned up. I'm a very big proponent. Everyone has to get their amalgams removed. And it's very, very important that you do this with a properly trained biological dentist. If you are trying to save some money and you're going to your regular family dentist and you just want him to drill out your amalgams, you're better off leaving them in your mouth. There is a lot of detrimental effects that come with having your amalgams improperly removed. So it's one of those things you really gotta, do it right, save up the money if you need to, but it's really important to do it right and get it out of your mouth properly and have your body supported properly. I also, root canals are a huge topic and the teeth are a big topic. And so everything needs to be looked at individually. I could say I would never recommend having a root canal. Like if you're listening and you're told you need a root canal and you haven't had one already, I would recommend not doing that and finding an alternate plan, like pulling the tooth and putting in a zirconium implant. You don't want to use titanium implants. Titanium is just as toxic as mercury. So nowadays we have zirconium implants that we're using, which are not toxic to the body. But if you have root canals, it's important, so by having a thermography scan, you can look at and see where are my root canals. And I see this time and time again in patients. If they come already diagnosed with cancer, like for example, at a patient the other day with prostate cancer. And I'm like, okay, I hope I don't find it, but I'm sure I'm gonna. And sure enough, the prostate, kidney, those are the front teeth. And so there it was, oh yeah, I had a root canal on that 20 years ago. And so now we have to start talking about what needs to be done about that. And I'm not a dentist, so I work closely with dentists, but that is something that really needs to be addressed if you want to prevent cancer or turn your cancer around. When I was a young doctor, I had one of my mentors from Austria came, and we were doing a lecture together, and he said he'd sit in and see patients with me for the day at my office. And I said, well, I don't want you to watch me see patients. I want to learn from you. You see the patients. I'm going to sit and be your student. And one of our first patients was a cancer patient. And he was, you know, I have a little bit of a better bedside manner, but he just he just looked at her teeth. He was like, you got to go to the dentist. You need like 5 teeth removed. I mean, I had to like calm her down and smooth things out, but it really cemented in me as a physician, like, this is really important. And this is not something we talk about in the United States. We kind of look at it, you know, now it's becoming a little more popular, but there was just there was a documentary on Netflix called The Root Cause, and it was taken off. Like, it was on, and then the American Dental Society, you know, a conniption fit, and you know, it's been removed, and that's really sad because it had a lot of really good information in it that needs to get out to the public. And so you know, if you are listening, like the IAOMT is a organization that dentists at least are like holistically minded, but you really need to find a good dentist. And you know, you may need to go biological medicine dentist shopping, you know, get a few opinions. So because it is a big thing, you know, it's very emotional to like think you have to have a tooth pulled. Like, we're very attached to our teeth, and rightfully so. But if they are an underlying root cause of why you can be developing cancer, why you have cancer, it's something that needs to be addressed.
Good deal. Yeah, moving on. You have the autonomic nervous system mentioned here as something you'd like to talk about, and it's always of particular importance to me. Anything to do with the nervous system. You know, the type of cancer my son had was neuroblastomas of the nervous system. What do you have to say about the nervous system, Dr. Stills?
So when we think about the nervous system, we're thinking about the 2 divisions, the sympathetic nervous system and the parasympathetic nervous system. So for those of you, you've probably heard of the sympathetic nervous system. It's correlated with fight or flight. And so it's the stress response. And we often talk about, like, you know, we evolved with the stress response for good reason. It was for survival. When we were hanging out in our loincloths and a saber-toothed tiger was about to eat us, we better have a stress response that gets us running and gets us up a tree and to safety so we don't die. Nowadays, everything is a stress response. A red light is a stress response. A full inbox is a stress response. Our job is a stress response. Taking care of elderly parents, taking care of children, taking care of our spouse, working, just everything. We tend to live in a very stressed out society. And on the end of the nervous system, we have the parasympathetic nervous system, which is like the rest and relaxed and digest and chill. And so I do measurements on patients to look at the health of the sympathetic and parasympathetic nervous system. And what I find continually across the board is that patients who have cancer have an activated sympathetic nervous system. They're just like stuck in fight or flight, and their parasympathetic nervous system is like in the gutter. It's not really anywhere to be found. And so it's a really important part of treatment that we start to calm down the sympathetic nervous system and activate the parasympathetic nervous system, because that's a big part. So I always say that I think like stress is like 99.9999999% of disease. And if you think about stress in relationship to cancer, when we are stuck in fight or flight, we have cortisol being secreted, epinephrine, norepinephrine. These are all the stress hormones. And what these stress hormones do, they compromise DNA repair. They suppress our natural killer cells, which are like, you know, our military that are going out and shooting cancer cells. They also suppress cytotoxic T cells. And the way cytotoxic T cells work is they recognize and kill cancer cells by like a ligand on the surface. So like a ligand, just think of it like a flag. And so they'll go in and they'll inject enzymes to destroy the cancer cell. And so again, these stress hormones destroy our immune system ability to go out and fight cancer. And so it's not really about getting rid of stress, because if you're alive, you're going to have stress. It's just part of the human condition. We all have stressful things happening in our lives. So it's more about how do you respond rather than react to stress. And so that's why I'm really big on mindfulness-based stress reduction, mindfulness meditation, because if we see that cancer patients are stuck in fight or flight and the stress response, this overactivation of the nervous system is contributing to cancer, what can we do to help you get out of that stress response? And I've been doing this a long time, and I can tell you the best thing I've found is to take up and have a mindfulness practice, because if you stop, so we do an activity with people in the mindfulness class where you stop and think about like something that's really stressful to you, whether it's physical stress, chemical stress, emotional stress, spiritual stress, whatever kind of stress, and just kind of like feel it in your body. And then we kind of have people shout out, you know, what do you feel physically? What do you feel emotionally? What do you feel mentally? And, you know, we feel our heart rate increasing. We're sweating. We're not breathing. We're angry. We're isolated. We're fearful. We're anxious. We're confused. We're overwhelmed. And a lot of these things we experience when we have cancer diagnosis or when we're going through cancer. And these are the things that are fight or flight. And so how do we reduce them? How do we get out of fight or flight? We start to become mindful. We start to realize that our breath in our body is one of the greatest healers we have. And so meditation is shown to reduce all these stress hormones, which is going to do what? It's going to allow your immune system to go fight cancer like it should be doing. That's what our immune system is there for. And for example, melatonin is a great molecule for fighting cancer. We think of melatonin as like a sleep aid, but it also inhibits cancer cell growth. So it'll increase interleukin-2, which is going to govern our T cells and our NK cells and even our B cells and neutrophils and macrophages. And so just meditating can increase our melatonin production. So we want to utilize ourselves. Like, yes, I use, and you know, patients of mine, especially my cancer patients, yes, they take a lot of supplements because those are my tools, those are my remedies, but they're not the be all end all. There are a lot of things that we can do within ourselves to help ourselves heal. And meditating and becoming mindful and not pushing away what we're experiencing emotionally can be such a great gift to ourselves. It's scary to have a cancer diagnosis. It's overwhelming. It's I mean, you're facing your mortality. And so we don't want to ignore that. So there are like guided meditations where you lie down and you can listen to a tape and you go to a deserted island and you'll swing back and forth on your hammock and it's all wonderful. But that doesn't really heal you. What heals you is waking up to your current condition and sitting with your condition and breathing through your condition and starting to accept what's going on. When we stop pushing and we start accepting, experiencing, and witnessing, it's then those things can move through us and can unfold and the stress can start to be reduced. If there's fear or depression or anxiety, I mean, I see even a lot when patients are, you know, we get them clear of cancer, you know, it's like, yes, celebration, but then what sets in often is fear of it returning. And so that's, you know, and it's a realistic fear. When we push away our emotions, and it's been shown, like the cancer personality, if you may, is someone who really doesn't experience their emotions. So they tend to suppress their emotions. And they've done studies showing this, that like people who should be reacting, who should be upset about something, they've had a loss in their life or something that, you know, is a normal thing to be upset about, where they're stoic or they don't cry or they don't express it, they're more prone to develop cancer later on, because these suppressed emotions have to express themselves some way. The body and the mind are interconnected. And so if you're not going to express them, they're going to get somatized and they're going to show up in the body somehow. And each organ, you know, I use a lot of different philosophies from Ayurveda, but from traditional Chinese medicine. So like the liver is associated with anger, and the lungs are associated with grief, and the kidneys are associated with fear. And so, you know, we all have our emotion of choice that we like to deal with the least. And so there will be correlation, you will see. So when I have a patient who comes in with liver cancer, we're looking at, what are you angry about? You know, they also may have some grief and other things, but there's like something central that's going on emotionally. And that, you know, and that's, it's not to like, by no means do I want to like make you feel bad or think, you know, oh, I like am angry and now I gave myself cancer. Like, we're all human. We all have these emotions, and we've been taught from childhood that the bad emotions are bad. You know, be a happy girl, don't cry. Why are you angry? You know, we don't want to deal with these more emotions that are thought to be negative. And through mindfulness-based meditation, if you just sit with the anger and, you know, welcome it in, it will just be there and then it'll move on. It's this not willing to deal with our emotions that makes them linger. And so it's really just embracing them, which sounds kind of counterintuitive. Like, I don't want to dwell in my anger. But when we appreciate and acknowledge things, they tend to move through us. Our emotions are just like waves. They rise and they fall. And so there's nothing wrong with being angry. A lot of people are like, oh, I'm just going to be positive and, you know, positive affirmations. And, you know, it's great to be positive and think positive things. But if that's not truly what you're feeling, then you're doing your body a disservice, and it's going to come out physically.
Well, I've been told I'm a little overly stoic at times, so maybe I need to work on that. I don't feel like I'm repressing anything though. Just not a lot really gets to me one way or the other. But I guess a childhood cancer diagnosis might do that to you. But yeah, and that's kind of like a good lead into the life themes thing that you wanted to talk about as well. I think it'd be a cool way to take it out.
Yeah, so I see when it, you know, so one of the best things I see is when a patient, I know that like we're on the road to cure and things are moving along well, when a patient comes to me and says, you know, Dr. Stills, I understand the gift of this cancer. And you're like, the gift of cancer, how could cancer bring a gift? It's this horrible disease. But all disease, especially cancer, comes with a message. There's a reason that our body breaks down. And, you know, in this day and age, even if you like eat all organic and you sleep and you drink and, you know, you do all these wonderful things for yourself that I, you know, teach people to do, we still have a very toxic environment. The air, the water, the groundwater, there's a lot of pollution. There's, you know, even if you don't personally spray pesticides, they're spraying it. You know, I was just in the UPS store the other day picking up my mail, and I'm like, oh my God, the guy like next to me is like the exterminator and he's spraying pesticides. And I'm like, really? You know, it's just, it's all over the place. And so, you know, emotionally, there are things that I see. So when the patient says, you know, I've got the gift, it's like, okay, what's the gift? And what did the disease bring to you? And so I see these life themes, for example, in breast cancer. So if you think about the breasts have to do with femininity. They're like a sexual organ, so they have to do with sex. And they also have to do with nurturing, because the breast is what we use to feed the infant. And so a lot of times when a woman has an issue with breast cancer, especially if it's on the left breast, we see it has issues to do with the child, with mother issues, issues in the home. And on the right side, I see right-sided breast cancer often has this life theme of being betrayed by a male, a partner. Also, we see a life theme of women who were born to men who wanted boys. And so they could never live up to their father's expectation because they were born the wrong gender. And so I see it a lot, women who are in bad relationships. And sometimes, you know, they finally leave the relationship, but it's like all the stress of that caught up with them. And then they get a diagnosis of breast cancer. So there are themes that I see associated. Pancreatic cancer has to do with leaving a legacy. So often, especially men, you know, they want to leave their mark. And if they have no one to leave this legacy to, I often see that with pancreatic cancer, with prostate cancer, kidney cancer, bladder cancer, see a lot of issues with family and partnership and security, with lungs or the colon, because the lungs and the colon are connected together within traditional Chinese medicine, someone who can't let go. And so if you think about the colon is our eliminatory, and it's a major eliminatory organ. And if you can't let go, so, you know, you're still holding that grudge from 15 years ago about how someone did you wrong, that all, you know, gets into our body, gets into our organs, and it creates disease. It can create cancer. And so, you know, knowing this and working with it's this beautiful opportunity to kind of do some emotional work on yourself. And so the cancer brings that gift. It brings that acknowledgement of there's something off here. And ultimately, we are here as human beings to evolve and discover ourselves. And so, you know, knowing that you've been upset with your mother for 25 years and the cancer kind of brought that to your awareness, and that you can work on that and repair that, whether, you know, your mother's still alive and you can actually go to her, or if, you know, she's passed on, that you can still do the work and repair and have understanding and invite forgiveness into your life. That's a beautiful gift. And often when that piece starts flowing, it's like all the physical stuff just starts working a lot better.
Are there, you know, outside of just kind of the obvious stuff that you kind of know that you should be addressing and just haven't, and this is a good opportunity to do it. Are there any, I don't know, programs or methods or, you know, that sort of thing that you know, point people to, you know, kind of diagnose some of this stuff and work through it?
I am a huge fan of family constellation therapy, which is Bert Hellinger's work from Germany. And so family constellation therapy needs to be done by someone who's trained to guide you through the process. But basically, you stand there and then you do it with a group and you pick people to represent, like, okay, Ryan, you're going to be my brother, and you pick someone else. You're going to stand in and represent my father, and you're going to represent my mother. And then the person who's guiding it just takes you through it. It probably sounds a little far-fetched, but I swear this is like the real deal. The people who stand in, so like, you know, I don't really know you, and if I asked you to stand in for my brother, something would happen and you start taking on the energy of my brother, and you're able to work out these family dynamics, and it really helps to clear what's been holding you back. So our families, our ancestors, we're a giant web, and so what's come before us really pulls on us emotionally and has an effect on us. So that's one of my favorite tools. I also really like, if you can find, like, I'm fortunate here where I am in Scottsdale, I have a master NLP practitioner who I have worked with patients with me. I think it's really important that you find tools. I like talk therapy, but I don't think it's enough. because a lot of what's driving our emotional issues is subconscious. And so you need tools that bypass the thinking brain. And so NLP can help get under to the subconscious and kind of pull out the weeds of improper thinking, of negative thinking, of anger and all of these things, and then can be replaced with a better program. So I like NLP. I love family constellation therapy. I love somatic body work because I do believe we store a lot of these emotional issues in our body, in our organs, in our muscles. And so finding someone who can work with you. I mean, I love a good massage, but someone who can really work and kind of dialogue with the pain. And I will have, even just at home, you can just start dialoguing with your pain. I have patients just start writing, and it's amazing if you just let it flow. And sometimes even writing with your opposite hand is a really great way to do it, because it gets you out of your conscious and into your subconscious, and just kind of write a letter to your pain, write a letter to your cancer, and just start to dialogue with it. Why are you here? What are you trying to teach me? It doesn't have to be a love letter. It could be a hate letter, whatever you're feeling. There's no wrong or right way. It's just where you're at. And so those are some great tools.
I just had a thought that it might be obvious to people, but going back to the mindfulness piece, that can help with pain and such. I've heard that brought up as a good adjunct for people going through conventional treatment as well. The special circumstances that they find themselves in. Is that something you ever work with folks going through cancer on?
Yes, absolutely. So, and just to be clear, like everything I'm talking about, can really be done alongside if you're going through conventional treatments. And so, this is your journey. I think it's really important to have, a doctor, such as myself, be a guide with you. But ultimately, I tell my patients, if they come to me, should I do chemo? Should I do radiation? Should I have the surgery? And I'm kind of like, I'll talk through it with them. But like what I often just end with is, go home and put your head on the pillow at night, because unfortunately there's no guarantees no matter what way you choose to go. So go home and put your head on the pillow. And if you're doing chemo and you're freaked out about doing chemo because you think the chemo is toxic and it's going to hurt you, that's probably might not be a good idea to do chemo. But if you are not doing chemo because you're afraid of it, but then like you go home and put your head on the pillow at night and you're like freaked out, oh my God, I'm going to die because I'm not doing chemo, that also is going to be detrimental. So you have to really feel good about the path you're taking. And yes, someone like myself can be a guide for you, but at the end of the day, you have to know, like, if what you chose didn't work, like you're going to stand behind it. You feel good about what you chose. It was what you felt was the best thing for you. So all of these things, that I'm talking about, mindfulness, working on your internal milieu, working on your lymphatic system, all of these things can be done whether you're going all holistic or you're doing chemo and radiation and surgery. It's really a personal journey that you have to take. And so the mindfulness is great, for going through your treatments, because, it's normal as you're going through this that fear, anxiety, confusion, all of these things are going to come up for you. And so having this tool to put you into your breath, to put you into your present moment, and to take down the stress hormones is such a great gift you can give for yourself. And so wherever you are, you can probably just Google MBSR. It's an 8-week course, and they're pretty much all over the place. And, it is something that it's really great to go take the class because you're with other people. There are some classes that are specific for cancer patients. One of the first classes I went and taught when I was training was at a hospital within a cancer support group. And so, you know, doing this, so you have the support of a community and you have the support of a teacher. Great book by John Kabat-Zinn, who is like the father of MBSR. That's who I studied with and that's who I learned from. He has a book called Full Catastrophe Living that really goes into this in detail. So I would totally recommend reading that book and then finding an MBSR class near you and spending the 8 weeks doing it. I hate to make guarantees or promises, but I promise you will get some benefit from it on many levels.
Beautiful. You want to let everyone know where to follow up with you, where to find anything or all things Dr. Stills, anything in particular in your work you'd like to point them to?
Yeah, pretty much. drstills.com is my website. Dr. Sharon Stills is how you find me on all social media. And yeah, that's where you find me. I also, I blog for Women's Health Network if you have women's health issues, but drstills.com is kind of my central hub. It's where I talk about my RED program. And if you want to see me as a physician or you need a referral or whatever you need, that's where you can kind of track me down.
And again, this was one of many amazing talks from our Anti-Cancer Revolution online conference series. If you would like the entire first and second events, along with detailed notes from the talks, together with the actual slides from the presentations, and most importantly, the ability to ask these doctors and healers anything you want yourself directly, that's what you get with Going Integrative Plus. This is the resource and community my wife and I would have given anything for when we were going through cancer with our son. Each and every week we get one of the top integrative and holistic cancer doctors in the world on a call, and you get to ask them literally anything you want yourself. Listening to this podcast for your health is amazing, but getting to be the one asking the questions yourself about whatever you're currently trying to figure out dramatically shortcuts the learning curve and helps you make more right decisions faster and avoid the wrong ones. You also get every past call we've ever done, which is hundreds of hours of content that's all transcribed, timestamped, and searchable, so you can see what all of our experts have said about any particular topic, which is a very nice antidote to how hard it's become to find good natural health information pertaining to cancer online these days. Huge discounts on all of our favorite supplements and devices, and maybe most importantly, a great community of people who are all on the same page with holistic healing. It is the absolute most valuable thing for someone serious about either preventing or reversing cancer we could imagine, which is why we made it. You can check it all out and become a part of it at goingintegrativeplus.com if you feel like this would be a helpful thing for you. And as always, remember, if you are going through cancer or anything else you'd rather not be, just keep going. God bless and Godspeed, and we'll see you on the next one.